the station that's on your side. This is Channel 7 News Good Morning Arkansas.
And welcome back into Good Morning Arkansas. Baptist Health recently introduced new technology to our state, and joining us this morning to explain is Baptist Health Advanced Interventional Gastroenterologist, Dr. Sven Hida. Dr. Hida, thanks so much for joining us this morning. Let's get straight to our questions. The first one is, what is the new technology and how exactly is it different from other technology there at Baptist?
Good morning, and thank you for having me. The new technology, ERBEJET 2, is really a combination of hydro and electric surgery. It really allows us to selectively dissect tissues, sparing vessels, nerves, other structures. It really minimizes the blood loss that we see with other surgeries. Much better visualization, reduces trauma in surrounding tissues. There's really no thermal damage as we dissect, and it very precisely and accurately targets the target tissues that we need to cut.
Why is the ERBEJET 2 used?
Why is it used?
Yeah.
It's used because it combines multiple tools in one in performing the surgery. Instead of having to change instruments out, it allows us for a magnified view of very precise tissue cutting, and therefore it's minimally invasive surgery, and it cuts the operation time in more than half.
Yeah, what are some of the other benefits to patients? You mentioned cutting the surgery time in half, but there are others.
Oh, absolutely. So it allows us to dissect tissues that have not invaded to the point of metastatic disease. It allows us to remove them very precisely. The speedy recovery is there as well. They can usually leave the same day. At this time, we're keeping them overnight for observation. And the benefit is immediate. The change is immediate and can be felt right during the surgery and right after.
So people that are watching out there may be asking, am I a candidate? Can you tell us exactly who would be someone that would need this particular technology?
Absolutely. So we do have selection criteria going on, like I said, with the tumors specifically. It's the tumor invasion that matters. Patients with achalasia, with the inability to swallow because of the lower esophageal sphincter, those have to go through certain testing first to make sure they're a candidate. Patients with gastroparesis as well have to go through certain testing before the procedure, but if they are candidates, then the procedure is the right one for them.
As a physician, this technology is really changing the way you guys work.
Yes, absolutely does. It's very compact. It allows us to do multiple surgeries in a day rather than one or two. And it really helps us in combining multiple technologies in one so that we can do everything we need to do at once with minimal blood loss and excellent effects right there in front of us.
Dr. Hida, what kind of feedback are you getting from your patients after they're getting these procedures?
So that's really why I love being a doctor. It's there, hearing someone saying that I can eat again for the first time in years, or hearing someone say that they feel better and they haven't felt that way in a very long time. They are incredulous as to the time that it takes for the procedure to happen, how quickly they get well, and how well they feel after.
What can our viewers do now if they're interested in finding out more information?
Certainly. Well, I certainly suggest that they speak with their physicians. They can also go to www.baptist-health.org and find out information, or they can call 1-888-BAPTIST and get as much information about this as possible. We're there to help them and to educate.
Certainly exciting times in medicine, exciting times there at Baptist. Dr. Sven Hida, thanks so much for your time today.
Thank you.